SeniorLivingGuide.com podcast discusses topics which are relevant to the everyday lives of seniors and their caregivers. We are joined by experts who share their knowledge on a variety of issues. SeniorLivingGuide.com podcast offers solutions and resources to create the best quality of life as we age. And now, let's welcome your host, Darlene Mahoney.
Thank you for joining us on this episode of SeniorLivingGuide.com podcast. We want to thank our listeners who have been the key to our success as we enter our third season of Senior and Caregiver Resource Podcasts. Our podcast can be listened to and followed most anywhere you enjoy music or podcasts, such as Spotify, Apple Podcasts, Google Podcasts, and even Alexa, and many more. And please don't keep our podcast all to yourself. Share with a senior or caregiver who you think will benefit from the support that we provide. I am your host, Darlene Mahoney, and I'm excited to share the news that SeniorLivingGuide.com provides a one-stop shop to finding senior housing, including independent and active seniors, a new home, while providing an excellent resource to assisted living, skilled nursing, memory care, or even home health and caregiving services solutions, and one easy to navigate website. So visit SeniorLivingGuide.com today. And I would also like to thank our podcast sponsors, Parish Healthcare and Parish Medical Center. At Parish, they offer the Parish Senior Consultation Center and Parish Senior Solutions, where each patient's evaluation and follow-up care will be personalized to meet the needs of the individual and their families.
At Parish Healthcare, we believe in our community. We believe in keeping our community safe. We believe in the art of healing. We believe in healing patients, healing families, healing communities. We believe in the best and brightest working together for the common good. At Parish Healthcare, our team focuses on you as an individual because every life is a work of art to us. Parish Healthcare, where the art of healing comes to life. Visit parishhealthcare.com/healthaware for a free health risk assessment.
Today on our podcast, we welcome Naomi McLeod. She is the Manager of Programs and Community Engagement for the Virginia chapter of the American Parkinson's Disease Association, also known as APDA. Her role at APDA is developing educational programming geared towards Parkinson's patients, their families, and the community's needs in Virginia. She graduated from Old Dominion University with a bachelor's degree in exercise science. Following graduation, she worked at Centera Healthcare as a rehabilitation aide, providing education and assisting in therapy treatments for stroke, diabetes, hip, knee replacements, and ICU patients. She later returned to Old Dominion University to pursue a master's of public health degree with a concentration in health promotion and behavior. Her personal experiences has led her to the field within public health, and she is happy to share resources and education towards families and people diagnosed with chronic and progressive illnesses. We're going to talk a little bit about, or not a little bit, a lot about Parkinson's. It's a subject we haven't covered yet in this podcast in literally almost 3 years. And I can't believe we haven't touched on it because it is such a big factor in a lot of seniors' lives. So welcome, Naomi. I'm so excited to have you. Thank you so much for joining us.
Thank you for inviting me, and thank you for having me today. I'm really excited to talk about Parkinson's as well.
Yeah, absolutely. So what is Parkinson's disease?
So Parkinson's disease is a progressive neurological disorder that it can deeply impact your quality of life. And with that, it can have motor symptoms and non-motor symptoms. So occasionally, when we think of Parkinson's disease, we think of the motor symptoms. So it can be the tremors, the shakiness, the balance, problems with gait and walking. But there are also a lot of non-motor symptoms associated with Parkinson's as well that can also be equally as problematic.
Yeah, I think a lot of the speech issues when I think of Parkinson's, because I know that it can definitely affect your speech as well.
Yes, it can affect your speech. It can affect sleep, anxiety, depression, a lot of things too.
Oh, wow. I didn't know all that. So how common is Parkinson's?
With the pandemic, a lot of new research has come out. Approximately, there are about 1 million people in the U.S. currently living with Parkinson's disease. Every 6 minutes, there's a new diagnosis with Parkinson's disease. And there are about 90,000 new diagnoses of Parkinson's each year. Definitely, it has increased in the last couple of years as well. We're not sure if that's because of with COVID and the pandemic that people are now going to the doctor more following, but it has been an increase.
Oh, wow. So you don't really know. Do you think it has anything to do with COVID, or do you think it has to do with people just being more aware of kind of what's happening with their bodies?
When the pandemic happened, hospitals were put on pause, doctors were put on pause. So there really was not access to, see doctors for a lot of chronic illnesses. And with Parkinson's disease, a lot of times people associate it with motor symptoms, but you can have Parkinson's for a long time before it's actually diagnosed. Some of the common things that people will say when they're being diagnosed with Parkinson's, that they may have lost their sense of smell, or they may have constipation or history of depression or some sleep issues, and come to find out several years later, then that's when those motor symptoms start to begin, and they are then diagnosed with Parkinson's. So they may have had it for several years, and then once the pandemic happened, they may have noticed that tremor maybe and say, hey, let me go get this checked out, and then probably diagnosed with Parkinson's from there.
Yeah, because the symptoms you just mentioned, not sleeping, who doesn't have that?
Right.
Anxiety, who doesn't have that? So you're talking about symptoms, and I use that loosely, that 90% of America doesn't have.
Right.
Women specifically seem to carry that around, especially women that are, going into menopause or perimenopause. Those are definitely symptoms of that as well. So trying to decipher, that's such a broad stroke symptom. And then of course, with the pandemic and with, so much stuff that's been going on in the last couple of years, those are just symptoms of life in general.
Life. Yeah. It's been tough. So
what other symptoms to look for, both the physical and the non-physical?
Well, I would say in terms of the motor symptoms and, with Parkinson's, the average age that people are normally diagnosed is after the age of 60 to 65. Our gait can be a little bit different. So our balance can be a little bit different. So sometimes, that can be with aging. But I think if you notice a shakiness and a tremor, or even if you're having walking issues, maybe going to a physical therapist at the same time to just kind of work on those issues, as well, that rigidity, that slowness, or sometimes you'll have called bradykinesia, which is that slowness and whatnot. So if you notice any of those symptoms, I would say to go to your neurologist to get that checked out. Now, just because you have those symptoms, it does not mean that you automatically have Parkinson's. So sometimes that could be an essential tremor, that can be a side effect of medication. So my best advice would be to talk to your doctor in terms of that, because it may not always be Parkinson's. There could be several other things that it could be as well. But that's what Parkinson's is normally kind of associated with, is those motor symptoms too.
Yeah, you don't want people panicking. I mean, there's so many different things that can cause the same symptoms of so many different diseases. I know that, UTIs can cause definite symptoms of dementia and Alzheimer's. So people automatically can jump to that, and really it's a UTI, which is, definitely a better diagnosis than a long-term illness such as Alzheimer's and dementia. So it's good to know that you definitely go to your doctor. That's your first. Don't get on Google.
Yes. Please talk to your doctor. They are the ones who can help you. And in terms of that, we have neurologists who are skilled in that, but we also have movement disorder specialists. And they are actually neurologists, but they have an extra fellowship that has more of a specialty towards Parkinson's disease and movement disorders. So we highly suggest that if you have Parkinson's, everyone is different, in terms of where they live. They may not have access to a movement disorder specialist, but if you are in an area where there's a hospital or some sort of facility where they have access to a movement disorder specialist, we highly recommend, because they have that extra level of care and the extra level of education that will be able to better suit them for Parkinson's disease too.
Okay. So what are the causes of Parkinson's disease?
So that is a question that is still ongoing. Part of what we do at APDA is, funding research and whatnot, because we actually still do not know. We have several causes, quote unquote, that we've seen a connection with Parkinson's. So certain risk factors. And with risk factors, it doesn't mean that you necessarily get Parkinson's, but they can increase your risk of Parkinson's. So for example, we say environmental factors. So being exposed to herbicides and pesticides. So a lot of times we see higher cases of Parkinson's in rural areas because, those like that farming and that exposure as well. Also, we see a high level of correlation between veterans. Because a lot of times, with Vietnam War, Agent Orange, if you've heard of that before, was when they used a pesticide for the Vietnam War for, killing trees and whatnot. Also, traumatic brain injury. So sometimes I feel like Muhammad Ali, he had Parkinson's. So those constant brain injuries can also increase your risk of Parkinson's disease. Men are 1.5 more times as likely to have Parkinson's. Like I said, it could be the correlation between veterans. Most chances that men are fighting in wars, and that could be that exposure too. Genetics can play a factor. About less than 10% of cases have a genetic mutation that is seen in Parkinson's disease. Now, it doesn't always mean that if you have a parent or a child who has Parkinson's, that you shouldn't automatically assume I'm going to get Parkinson's too. But there has been some studies shown that genetics can also be a correlation as well with that. And then also, as I mentioned, age. The older you are, there's always a higher chance of risk of, having chronic illnesses and whatnot. So their average age is about 60 to 65. However, we have something called young onset Parkinson's disease. That is where a person who's under the age of 50 is diagnosed with Parkinson's. And that's about 10% of the PD population can have young onset Parkinson's.
Of course there is. Has that increased? Because I know that we're seeing now that with Alzheimer's and dementia that it's getting younger in those diagnoses as well.
Yeah, I mean, Parkinson's is just such an interesting disease. I'm not 100% sure as to why. I know that there's a lot of research being done onto why that could be, but we have noticed, I think, that with young onset, their symptoms aren't as severe as those who are diagnosed later in life, but we're not 100% sure as to why right now.
I mean, that clearly, our environment is continuing to change. Lifestyle and diet continues to change, and those could definitely have some factors with younger generations with both of those diseases, I'm sure as well with the younger people. I mean, I hate that. How is it diagnosed?
In terms of a diagnosis, there actually is not a test. So if you have Parkinson's, you won't go to a doctor and say, hey, let me get this test for Parkinson's disease. So it's diagnosed clinically. So there's not an actual test. What doctors will do is that they will look at your symptoms, look at your family history, and then they can go from there. Luckily, we have access to great healthcare. So there's some tests that can assist in diagnosing with Parkinson's. But based off those tests and based off the history that's been discussed, they can go from there in terms of diagnosing Parkinson's. So one will be a DAT scan, which is kind of like a PET scan, where they will look at the brain and notice how much dopamine is seen. Because with Parkinson's, it is due to a lack of dopamine in the brain. So if you have a smaller or diminished amount of dopamine in the brain based off that PET scan and based off the information that's been available and discussed, then they can say, hey, you may have Parkinson's disease. They also have a skin biopsy, which is done, and that's more newer. And they take a small biopsy from 3 parts of your body, and they're studying the protein, because with that, certain neurological disorders can be diagnosed based off that level of protein with the skin biopsy. So it is a little bit hard to diagnose. And with that also, if they think you have Parkinson's, they may put you on a medication and see how you respond to that. If you respond to medication, then they'll say, hey, based off what we've done here and your results based on doing the medication, then you'll say, hey, you may have Parkinson's. And if you don't respond to the medication, then they'll kind of continue to look further deep to what it could be.
Yeah, kind of mark that out and start looking at other things. So the skin test is really interesting. I've never heard of that before.
Yeah, that's something that has been new. And I listened to a conference last week and they talked about the skin biopsy. Like I said, it's kind of difficult to diagnose. And I think by having those medical advances in terms of technology and being able to say, hey, well, certain diseases have these markers with Parkinson's or whatnot, and that's able to help eliminate confusion as well. It's definitely great that things and research is being done to help with that.
Yeah, for sure. Let me ask you this with Parkinson's. Is the progression of the disease, is that something that completely varies from person to person?
Yes, we always say Parkinson's, that every person's case is different. So what could be happening to one person is not going to happen to another person. And to really try not to compare yourself to what other people's different stages are, with any, chronic illnesses, that there's different stages. So everyone's journey is different. Everyone's case is different. So everyone has a very unique case. It's not just a one size fit all. And anyone who you would talk to associated with Parkinson's will tell you that every person's case is different.
Yeah, it's so strange. My aunt was diagnosed with MS in 1997. It freaked me out quite a bit because she was very, very young. She had very young children at the time. And I actually knew someone in high school who was diagnosed with MS at like 17, 18 years old. And clearly it's a completely different disease. But the girl in high school, by the time we graduated, could not walk to get her diploma. And my aunt, who has had it for such a long time, is still able to walk. And she clearly has a lot of like physical pains and aches and some issues and things like that. For the most part, you wouldn't know by looking at her that she has MS. So that's the huge difference in progression. It's so strange how the progression of the same exact disease affected them completely different.
No, I agree. And sometimes it's so easy when you get a diagnosis, you're like, oh, let me just Google, let me go see what things to look out for. But it's like you never know. Everyone is different. You just to take that into consideration, as life happens, to just not always look into Googles and whatnot. Really just talk to your doctors. They're the ones who really can help you and assist you, navigating your illnesses.
Yeah, absolutely. Well, this has been really great. We're going to talk a little bit further. We're going to take a quick break and we're going to talk about the best part, the treatments after a diagnosis and support.
Hey, Mom, how's the retirement home search coming?
Oh my gosh, I'm just so stressed out. I don't even know where to begin.
Well, why are you so stressed? What's the matter?
I don't know where to find anything. I just need everything in like one place and know what all the options are.
Does the idea of searching for senior housing seem overwhelming and you just aren't sure where to even begin? SeniorLivingGuide.com has great news for you. We offer a one-stop solution to take the stress out of your senior housing search. At SeniorLivingGuide.com, both our statewide Florida edition book and website are created to make your senior housing search very easy for you to navigate. We provide details on communities, including retirement, assisted living, skilled nursing, memory care, and home health, allowing you to decide which best fits your needs and then connecting you directly with those communities. Visit us online at SeniorLivingGuide.com.
At Parish Healthcare, we believe every life is poetry in motion, motivated by strength and determination. As your bone, muscle, and joint healthcare partners, we believe in blending the art of healing with the science of medicine to keep your body in motion. We believe in healing patients, healing families, and healing communities. For a free orthopedic health assessment, visit parishhealthcare.com/orthoaware. Parish Healthcare, where the art of healing comes to life.
All right, we are back with Naomi and we're talking about Parkinson's. And we've just talked a little bit about the causes and the diagnoses on how to diagnose it, which was really super interesting. And then also what symptoms to look for. But we're really going to dig deep into more treatments and resources. So tell me a little bit about what those treatments might look like, Naomi.
One of the most, earlier when being diagnosed with Parkinson's is that a doctor may put you on medication. And with that, there are numerous different types of medications. I won't, get too deep into that. But the point or purpose of the medication is to either mimic or replenish that dopamine that I talked about earlier, as I mentioned with Parkinson's. So with Parkinson's, like I said, it's due to low amounts or diminished amounts of dopamine that can control the movements of the body. So that medication is used to replenish or mimic that action. And I talked about earlier, every person with Parkinson's is different, and a neurologist would know better, how to titrate those medications. You may not know, but it's not a cure for Parkinson's. So with that, doctors can prescribe medications for the motor symptoms that I mentioned earlier, as well as the non-motor symptoms. So, sometimes we have seen people who have Parkinson's, they may be put on a low dose anxiety med or depression med. Also with treatment, lifestyle is highly encouraged in making changes up after being diagnosed with Parkinson's. First, wellness, really seeking a physical therapist, occupational therapist, or a speech therapist. So a physical therapist can help with those large chunk movements in terms of balance, in terms of strength. Speech therapist can help with those vocal cords, because sometimes with Parkinson's, the voice can get softer, can be sometimes at risk of choking and whatnot. And also with occupational therapists can help with those fine motor movements. So things with your hands, opening jars, smaller things of that nature. And the good thing about rehab therapy is that they actually have a program called LVST Big and LVST Loud. LVST Big is actually a program for physical therapists and occupational therapists who are clinical therapists who have an additional certification to assist those with Parkinson's disease. That's a more tailored program. And then LVST Loud is also a program for speech therapists to work with Parkinson's patients who may have speech issues that solely focus on those vocal skills with Parkinson's disease. So if you have Parkinson's and are currently seeing a physical therapist, occupational therapist, or speech therapist, I highly recommend looking for services that specialize in LVST Big or Loud. You're also able to look on their website and to see geographically, where are those clinics that have that certifications available for that additional help.
Okay. So we'll put a link to that in the content section of this podcast so that that's clickable and you can get more information on that if you're listening. Perfect.
And then I also want to touch on too, in terms of the importance of exercise. With Parkinson's, as I mentioned earlier, your gait can be impacted, the shuffling of the feet, the tremors. We really want to encourage really anyone, over the age of 60 to really be incorporating some type of exercise into, their daily living. But especially with Parkinson's, with those motor symptoms that I mentioned earlier, what we don't want to happen is that you're being sedentary and being conditioned, because you want to continue to move your body. So we highly suggest anything that really gets you up and moving, that challenges you, that breaks you out in a sweat, that elevates your heart rate, is something that we highly encourage. So we highly encourage exercise that challenges your strength, your flexibility, your aerobic exercise. And the great thing about nowadays is that, you can just Google Parkinson's disease and dance. Parkinson's, they have something called Rock Steady Boxing, which is national, and they have classes. I've seen YMCA, they have cycling and rock steady. So there's so many different ways to exercise. You don't like dancing, you want to do boxing. There's something for everybody out there. So please do not let, that discourage you from joining something or doing something, that there's something for everybody. And I've seen now they have pickleball, Tai Chi, Zumba. If you're not having great mobility standing, they have sitting Zumba. So there's always, adaptations that can be made to encourage those to still exercise as well.
I love that, sitting Zumba. This is what I'm thinking. And you just kind of mentioned utilizing YouTube. Almost everybody has access to YouTube, especially if you are doing anything with a Roku or anything like that. You can access YouTube on your television. There are so many exercise videos that you can do right in your own living room. And I would bet there's some that are very specific for people with Parkinson's, I would imagine. I'm just, spitballing here. Yeah. And if not, sitting Zumba.
If you just put, search chair sitting, or I think it's called silver sneakers or something with Zumba, and you can sit in the chair. And I think it's also, a lot of sometimes exercise programs can be very costly. With managing a chronic illness, I can't imagine how much that can cost, and wearing your pockets and whatnot too. So taking advantage of those opportunities that, are free is really great, because a lot of times these people are still certified. And like I said, due to the pandemic, we had to change our model of doing things. A lot of our services were in person. Now we've adapted to being online too. So there's always a way to still get your exercise, but, being creative in terms of your thinking and how to get those resources.
Exactly. That is so cool because you really can utilize that YouTube to do the in-home. But then also, if you just even wanted to walk and you wanted to walk inside, you can utilize the equipment at the gym. That's such a great way to do that, in a safe environment to do that. But I never thought about like the boxing. You know, kickboxing I love to kickbox, but I would think that would be a really great, because you have to have the hand and eye and leg coordination, which I don't particularly have. I love doing it, but I do find that, I'd probably lose in a battle, but I love doing it. You have so many amazing ideas on the exercise route. So as far as like the nutrition, is there a nutrition factor that goes with Parkinson's as well?
Yes, I think we try to advocate for making changes within your own environment, like I said, in terms of exercising and learning what you can control. And we highly encourage that you can control your exercise, you can control your nutrition. Research has, shown that the Mediterranean diet has been the best diet for those with Parkinson's. The typical leafy vegetables, legumes, lean proteins, staying away from sweets, fried foods, fats, of that nature. The Mediterranean diet is also a diet called the MIND diet, which is a variation of the Mediterranean diet. And through that, they have shown a slower progression of Parkinson's disease. It's very good for the brain health and very good for your heart health as well. Also, in terms with Parkinson's disease, is that sometimes constipation, as I mentioned earlier, can be a motor symptom. It's also a side effect too with medication. So really increasing your fluids. That's why we also encourage exercising as well to kind of stimulate those bowels, and then also really incorporating, leafy vegetables and fruits as well. Like I said, it's typical, healthy type of diet, but really being careful of what you're eating too is also very important with Parkinson's.
That Mediterranean diet is also recommended for folks with Alzheimer's and dementia as well. And then even if you're have a propensity for it, because it's definitely something that can be inherited, because that does run in families, to have that diet in your life, I guess, prior to any kind of diagnosis. So that's something that people really need to focus on, I think, and consider that particular diet, because it does seem to be one that is healthy in general.
Yeah, and I know that it can also be hard too, as you get older, sometimes you may not want to cook. Even now, I kind of eat in that similar state of terms of kind of like that Mediterranean diet, but it's so good for you. And sometimes with Parkinson's too, you can have stomach problems or GI tract issues. That's why the Mediterranean diet is also good, because you're not having those excess fats. It's just very clean and whatnot as well.
Right, exactly. That's such a great tip. Thank you for sharing that. We utilize medication, which clearly is something that a doctor is going to prescribe for it. Physical therapy, speech therapy. It's a acquaintance. And I think that is probably the hardest part that she struggles with Parkinson's, is the speech. I love talking. I could talk and talk and talk and talk. And that would be probably one of the hardest things for me to give up or to struggle with, is being able to communicate, with speech. So I can only imagine the frustration with that. So I think, clearly the speech therapy is definitely a big one. So it's just a accumulation, is that the correct word, of all of these different things that work together to help have a better quality of life while you're dealing with Parkinson's. So I did want to go over some support groups. We always want to provide additional resources and support for not only the person that's living with Parkinson's, but also for people that are their caregivers, or even their spouses, if they don't even want to consider themselves a caregiver per se, but on how to live and kind of support that person who's living with Parkinson's. What kind of resources and different options do you think would be beneficial?
I would definitely suggest joining a support group. There's different support groups as well. There's support groups that can give you education. There's support groups where you can just go and just listen and feel whatever you're feeling, and talk about the things that are bothering you, or, that you're having difficulty with. So there's different types of support groups. They have some that are just for care partners who are kind of all in a similar stage in life of taking care of someone with Parkinson's. When you hear the word support group, I don't want anyone to be immediately turned away It's not like what you see on TV sometimes, like, hey, join a support group where you just sit and talk about your feelings. I think with Parkinson's, there's something for everybody out there. There's different ways that support groups can help people. But it's really for community. It's for people who can have someone who understands how they're feeling, what they're going through on a day-to-day basis, and to also really share resources. I've been in support groups where they'll talk about our walking or our bladder issues with Parkinson's, and everybody has, well, hey, you should try this, or you should try this. And that's sometimes even better than going to a doctor, because someone who has Parkinson's who has had it for a long time, being able to use that person as a resource, or that person, or you should try this doctor, you should go to this person. So it's a place to build community, to meet other people who are kind of going through the same walk of life as you are. So with that, with APDA, part of what we do is providing resources and education and trying to point people down, the right path to receive that help. I'm in Virginia, I'm the program manager there, but APDA has chapters all across the United States.
So I'm going to stop you really quick. APDA, we want to remind, that's American Parkinson's Disease Association, so that everybody is just quickly reminded of what that stands for. Okay, go ahead. Sorry.
Every state does not have a current chapter, but numerous states across the country have a chapter. First, I would say go to our website. Hopefully they can link that, in the notes.
We will.
But first, looking for if your state has a chapter. And through there, there's a person, either a chapter coordinator or a program manager, similar to my role, where we have support groups for all across the state. So I have my own referral list of support groups all across Virginia. And through that, we'll get calls or emails. I'll say, hey, I live in Norfolk. I want to join a support group. How do I join? And we're able to kind of connect them, with that resource. So if they say, hey, I'm a parent, or I'm, my husband, has Parkinson's, I want to join a care partner group. We'll look for you and say, hey, well, here's online, what you're looking for in person, you're looking for virtual, and we'll connect them with the support group. Through that as well, we also can connect them with neurologists. If they're looking for exercise programs, that we're able to point them in the right direction. If there is a need for a support group. So let's say, hey, so currently right now in Virginia, we don't have any in-person support groups, due to COVID, all of our support groups are virtual. But we've received a huge need for in-person support groups. So part of what we'll do is that we'll look into finding a facilitator, finding a venue, and then finding a support group. So we're really here to kind of meet the needs of the community in terms of programming as well. We started a webinar series. We have the option to say, hey, what do you want to see next? And really listen to the community about what they want to see programming that can actually assist them as well.
Right. And the thing is, you talked about a little bit about support groups in general. I think with a support group, part of the reason for that is, I think if you don't do support groups, sometimes you feel like you're completely alone.
Yeah.
And you're the only one that's going through it, or you get in your own mind, am I the only one that's experiencing these XYZ symptoms? Or is this unusual? Or is this worse than most people's? And you get into your own head. But when you go to support groups, you listen and you realize I'm not alone. And you have a sense of other people are having similar issues. And then also there's always tips and tricks, I think, to what people are trying. And it can give you some idea. I think maybe sometimes if you're having issues, that maybe you can try this and it would give you some relief on something. Just being able to realize I'm not the only one that's going through this, that's worth its weight in gold.
Yeah. I have had family members who have chronic illnesses, and I really can't imagine that. It's probably a very isolating, and everyone, may not have a partner, or they may not have a child that can help them as their disease progresses. It can be very isolating. It can be a grief process that sometimes is not talked about too. People, depending on where they are in life, they can still be working. They may be already retired. So there's a lot of feelings and emotions that are also, tied to being diagnosed. And I think part of a support group is to kind of help being able to support you with that as well.
My mom, when she went through chemo, she liked when certain people, they took chemo together, and they were never friends outside of chemo, but it was her friends in chemo because they had that camaraderie of going through cancer, and they weren't negative. It's not like they were going in there and having a boohoo party. they just had that camaraderie of chatting with each other and kind of sharing their similar life experiences, I guess I could say. It just gave her, she wasn't alone in the world doing this chemo thing, which sucked. So I think it's the same kind of idea.
And I would say too, part of what we do at APDA too is also in terms of the support, but also developing programming as well. So part of our signature programs that we just did actually 2 weeks ago, we did an art program. It's called Connecting Through Art, and it was an in-person program. A lot of our programs have been virtual, but we want to start, that in-person component as well. And that was so nice because, with the chronic illness, sometimes you can be, like I said, home a lot, very isolating. So we want to be able to create programs that can get people out the house, to be able to meet people that are in your support group too, and then actually do like a fun activity. I was sitting there painting, we played music, we had refreshments, and it was just so nice. One person said I felt normal, I felt like I didn't have Parkinson's that day. So we really just pride ourselves too on the support groups. We also have a financial scholarship, so we award up to $400, and that can go towards medications, exercise programs, therapy, transportation. If you have Parkinson's, and depending on your chapter, or if you don't have a chapter, we have a coordinator, national coordinator, who can also assist in that grant process as well. Really, our job is to really educate the community, to provide resources, to create programs that improve their quality of life, that can still have a meaningful life with Parkinson's too.
So you just said something that literally just like rammed through me. I felt normal. I felt like I did not have Parkinson's that day. I would love to hear that on a daily. I would love to hear that. I love that. To create a world where more and more people feel like that. I love the art therapy and being able to gather like that. That's great. I'm glad you're able to do that more in person.
It kind of inspired me too, because like I said, I had personal connections with those who've had chronic illnesses. But, like I said, it could be a very isolating experience. And just to be able to go somewhere and to not have to pay for something, all of our programs are free. And just to be able to do something fun, it inspired me. It made me feel happy. And they said, we want to do cooking next. We want to do, what's the next program that we're getting ready to do? It's good to keep your mind moving. And we really wanted to continue to do programs like this that can encourage those to come out, especially as it starts to get warmer and spring is coming soon, to really take part, in those activities. We don't want people to be at home and to be isolated. And I listened to a conference last week. It said there's still life with Parkinson's. Life doesn't have to stop once you're diagnosed. It's important to see your neurologist, see a movement disorder specialist, to get medications. We also stress the importance of having a healthcare team. So whether that's, your speech therapist, your occupational therapist, your physical therapist, still your primary care physician, we still want you to still be active and be moving. We don't want you to be home following your diagnosis. It's really important to continue to keep moving. And if you're having problems with your medications or problems, to really see your doctor, but it should be nothing that should keep you home. We want you still to be moving.
Life doesn't stop with a diagnosis of Parkinson's. Boom. There you go. Well, thank you so much for joining us on this podcast.
Thank you.
I have learned so much, and you've shared so much great information that I hope that our listeners, and you said care partners. I like that. We always say caregivers, but I like the care partner. We're able to gain some great information, some resources that are going to help in their everyday lives. Thank you for joining us.